Hi guys, it's Vet Day today and we are welcoming Dr. Michelle Allen from Allen Equine Veterinary. She's going to be performing some routine dental care today called floating. Dental care is absolutely crucial for the overall health of your horse, and it can prevent discomforts, it can prevent chewing issues that lead to digestion problems. It can also help prevent training issues. So it is super important that you have routine dental care done. Today we're going to be working on Ember, so come on, let's go take a look.
Hi, I'm Dr. Michelle Allen with Allen Equine Veterinary Services. We are going to do a dental exam and float today on Ember. And the reason for doing dental exams and floats on a yearly basis for horses is to manage any sharp points that they get in their mouth and check for any sort of loose teeth or infected teeth or even fractured teeth. And managing the sharp points in their mouth and their mouth conformation can significantly help us improve their dental health over life and reduce the risk of gum disease as they get older. I've started on our oral exam with Ember, and you can see we used an oral speculum to open her mouth up. We've given her some sedation to make her relaxed and so that she doesn't move, so we can be really precise with our exam and with our float. And we have a really good light source here so we can see really well. It's really important to be able to do an oral exam so that we can see and feel all of these teeth and identify any abnormalities that we could potentially treat. And the next thing we're going to do would be an exam with a mirror to look at the surfaces of the teeth and see if she has any feed packed between them. And then we're going to look for sharp points that may cause some ulcerations on her cheek and be painful for when you're riding them and when they're chewing. And any other abnormalities that we can help keep the mouth in good condition. Some horses are born with naturally good mouths and some horses are not. And so it really depends on your horse how often they need to have all these things done.
So Dr. Allen, you use power tools. What's the benefit of using a power tool versus a handheld float?
Sure. The benefit is that this is a little bit of a smaller surface area compared to a hand float or rasp, which the surface area is going to be a lot bigger. We can be a lot more precise on each tooth with these smaller tools. Because it's motorized, it works faster than a hand rasp, and for that reason, we can be a little quicker in our float, and we do have to be careful about how much heat we create on a tooth, so we have to be quicker in the work we do. But it also, because we're quicker, they don't have to have their mouth open for quite as long too, so it puts a little less stress on their jaw muscles and their temporomandibular joint. Horses' jaws are naturally shaped a little differently, so they are wider on their upper jaw and narrower on their lower jaw, and horses chew in a circular motion. And this creates sharp points along the cheeks on the upper teeth and along the tongue on the lower teeth. And those sharp points can be so sharp that they cut into their cheeks and cause ulcerations. Sometimes they are bleeding even. So they can be very painful.
Yeah, so we do the dentals to prevent that, to soften
the edges. Exactly.
Wow.
Yep.
Okay, great. Okay, well, let's get this going.
Okay. So some people will ask for a bit seat on their horse, and that is where we round the edge of this tooth. This is the 406 and 306 tooth, and you round the edge off so that potentially, if you're worried about bit interference, it's not as sharp of an edge there. The concern sometimes for doing that is there is a pulp horn right here on the edge, and if you take too much of that tooth off, like we're talking millimeters here before we get into that pulp horn, that can damage that tooth forever. You can round this a bit, but you just have to be careful not to go too deep. So these are adult teeth that have come in. You can see how much bigger they are. These are caps. These are baby teeth that haven't come off yet. So she's got an adult tooth coming down. It's going to pop that cap off and grow in its place.
And right here is the cap.
Yep, and you can see how it's already separating a little bit from the gum. So in the next month or two, that's going to come off.
It's even getting a little loose.
Mm-hmm.
There's so many other things that can be found in a horse's mouth besides what we saw today, but Ember is only 5 years old and she's had a dental exam and floating every year for the last 3 years. And as you saw, there were issues of concern and places that need attention. And that's why it is so crucial to have a regular annual dental exam and floating done by a veterinarian or equine dental specialist every season to ensure that your horse is healthy, comfortable, and performing at its very best.